Welcome to the Compass TV show. I'm super excited today. We're going to touch on a topic that most people say, wait, don't talk about that. But it's going to be a blast because talking about it is what helps each and every one of us. And as we're recording this show, it's a gorgeous day out, but we won't talk about the rest of the week.
No.
So with that, I'd like to welcome Clarissa Dumdei. And Clarissa,
thank you for having me.
Yeah,
yes.
I'm so excited because it's a topic I know that you're passionate about. And I know myself and Heather in the office, we're also passionate about it, knowing that by having the conversation is where it really truly begins. And so that's where we're going to go today. But before that, how about where'd you grow up? Because I know my audience wants to know all that good stuff.
Oh, yes. So I actually am local to this area, so to speak. I grew up in Danube, Minnesota, if anybody knows where that is.
I do.
562 people when I grew up there. So was a graduate. My husband and I are from this area. So I went to college at SDSU and was a jackrabbit.
All right.
And then finished off my public health nursing and was a home health nurse and decided I wanted to go back to school helping just more of the geriatric population. That's kind of what spurred it. And then I ended up at St. Scholastica, finished off my NP. And so my roots started actually at the Renvilla Nursing Home as a nursing assistant. And that's where I fell in love with geriatrics and just nursing, all of that kind of stuff. So it's been a long journey, but it was a good journey for me. So to be an LPN, then an RN, then a public health nurse, and then an NP.
Wow.
So yeah, I worked kind of all the way up the ladder, which was, I thought, really nice to be able to see all those different settings and how to help people all the way through. So worked out good.
That had to have been really interesting, like you said. You start out right here, the basic care, and then how you stepped up and all the different forms and types of care that you had in your arsenal to, so to speak, to help people.
Well, and then it was nice to be able to see at each level, what are you capable of doing? And so what does, the nurse do? What does the aide do? What does the provider do? And it was nice to be able to kind of differentiate that. So I knew in my nursing career, when I was in public health, I saw a lot of people during home care that I would see, and they were having trouble with their memories and taking medications, or couldn't get to their appointments, or ended up back in the hospital because of all of those different factors. And so it was kind of like, how do we bridge that, helping the geriatric or older population with all of their chronic health conditions, but also the memory piece, which nobody really wants to talk about and nobody really wants to hit on because, it's, number one, hard to talk about it. There's a fear there. Number two, there's a stigma with it that I think a lot of people are hesitant to even, talk about the subject or even bring up the subject. And then everything else that goes along with it. Can I drive anymore? Will I be able to stay home? How am I going to take care of myself? What will my family think? There's just so many pieces. So that's what kind of spurred that, even going back to school again, to say, older generations, we need to give that respect and be able to be present to help with care and not just say, you're old and this is it, because that's not it. There's a lot of life, of life for people.
I just love your line. It's not just that you're old and this is it. There's a lot of life yet. And I love that piece because I think so often in society, especially in American culture, it's that once you hit close to 65, it's like, okay, you're old. You're done.
That's just beginning. You're done working and the fun starts.
Yeah, exactly. the next new journey and adventure begins. But along that journey, sometimes we come across issues that we're going, I really don't want to talk about this. Do I have memory loss? Do I not have memory loss? Family members. I mean, where do we begin? Let's start with the Memory Cafe, because this is such a broad subject. Let's start with the Memory Cafe in Marshall. Where is it? Kind of how did it begin? What are the nuts and bolts? Say, oh, maybe I might want to consider that.
So Memory Clinic started September 11th of 2000 and I gotta think now, 17 it was, 2017, Yep. I got to think, because I've been in Marshall, it'll be 2 years coming in May. So
I know, it's crazy, isn't it?
It has flown by, so I got to think of which year I'm in. And so basically, before I came down to southern Minnesota, I had a memory clinic for 2 years in northern Minnesota. And so part of that was really focusing in on memory changes and just starting from the ground up. So a lot of the folks that I was seeing in, for example, a transitional care unit, so a long-term care facility that has more of a specialized unit for people coming out of the hospital.
Right.
We kept seeing folks that maybe were in after a hip fracture having changes with their memory, or folks that maybe have heart failure, they have breathing troubles, and they kept coming in and out of the hospital.
Right.
So my doc and I decided one day, he said, you know, all these people, we keep seeing them. I said, anybody want to talk about the memory piece? Because that's like the big elephant in the room.
Right.
If they can't remember how to take their medications or do their follow-ups,
right.
how are we ever going to help with care, you know, to really start from that point and move forward? Right. And he said, if you can figure that out, let me know. And so an occupational therapist and I, her name is Sarah, she was very passionate about dementia care. And we started brainstorming and saying, what would it look like? A good service delivery system, what would that look like and how would we do it?
Okay.
And we started brainstorming, and from there, Memory Clinic kind of took off. And so when I came down to Avera, they were very excited about the geriatric piece, but the second piece, when I brought Memory Clinic, there was some really wonderful key providers that I still work with today, including internal med and family medicine, that had already started in looking at memory services.
Oh, wow.
So they had
Wonderful.
started the foundation before I even got here.
Right.
And a lot of what they had was exactly what I was doing in northern Minnesota. It's just they needed to fine tune, I should say, and tweak a little bit. And then memory care kind of started from there. So we have a multidisciplinary team. So we have care coordinators. I work with Amanda and Courtney. They're both nurses. We have the occupational therapist and speech therapist with Big Stone Therapy. Myself, who's the geriatric kind of provider behind that. You know, we also will encompass services such as neurology or neuropsych when needed.
Right.
And the hard part is we're in Marshall. They're in Sioux Falls is the closest piece. And so Memory Clinic is really devised as kind of being that one stop to start when it comes to memory loss. So when somebody goes to see their primary care provider and maybe they're noticing changes, or they're having their Medicare annual wellness exam and they're doing that kind of routine screening and something is different. And then from there, what do we do?
Right.
And so part of clinic is just having a cup of coffee, sitting down and saying, you know, what's going on with your memory? What are you concerned about? What's working well? What isn't? And then looking at all of the other pieces that might be factoring into memory, because a lot of people, Barb, don't think of memory loss being sometimes reversible based on some different pieces in their health.
Right.
So for example, if you have a thyroid issue and you've never been diagnosed and you need to be doing something with that, that might be something reversible. Or recurrent infections like a bladder infection, or for example, different medications that might be affecting your memory that perhaps you started long ago for X, Y, and Z, and now do you really need those medications? And if you don't, then is that helpful? Right. Depression and anxiety is a really big one too, Barb, that we look at, because a lot of people, I would say over 50% of the people that come visit, depression and anxiety is first and foremost not treated, and that affects their cognition. You treat the depression and anxiety and you see a significant improvement in cognition and their memory function.
Wow. Wow. I think that's a huge piece, because well, let's be honest, with this Minnesota winter, we're probably all a little down. So if we know that we're feeling down or having some anxiety, then maybe if we treat that,
that can be
just to think that that can help and change that memory piece is, I think, just really, really critical. So the Memory Care Clinic here in Marshall, let's say there's people out there, let's say there's a family and they've noticed changes in maybe a parent or sometimes a sibling, because it can hit younger too, and one person wants to address it, the other person doesn't. What can the Memory Care Clinic do for that type of situation?
So that happens very often. So if you can, I encourage families to come together, because one of the things is you often have a family member that's not local. Mom and dad are fine, you know, that person is fine, nothing's going on with them, you know, and then they come to visit and all of a sudden it's this big change, and oh my goodness, what are we doing about that big change? And so I encourage family members to be present, and those that live far away can be on a phone, but we'll oftentimes do kind of a round table. So when someone comes into Memory Clinic, to start with that evaluation, look at their medications, look at their labs, look at their imaging studies, everything else, and then involve family with that to say, here's what I think is going on, here's what our options are, here's what we can do for care. We're going to continue to be part of that that process all the way through, the prognosis or the diagnosis, I should say, and to support families too, because it's getting everybody on the same page and coming together. And so sometimes it's just that communication with family members, and you have to be open and willing to look at it. So some family members, great, and there'll always be, you know, some families that they'll be the holdout that nothing's wrong with mom or dad, but as the disease progresses, you're going to see those changes, unless something else in their healthcare, you know, changes what happens to them. But you know, dementia is not a curable disease, and I think that's something that a lot of people are kind of hoping for, and the cures are hopefully coming someday, but we're not there yet. So I think it's something that, you know, people think about terminal illnesses, they think about their heart, they think about lung, they think about cancer. But dementia is still a terminal illness too.
And I'm so happy that you said that dementia is a terminal illness. It's something that amazes me, that I'll come across conversations multiple times. Well, did you see in this magazine, or did you see in the newspaper, or did you see on TV that ad that says if you take this, it'll cure your forgetfulness? And I'm going, no, I don't think so. I said, I don't think there's any scientific proof behind that. So, and I think it's really important that the medical community, and I'm glad to hear you say it too, that it is terminal. So then, just as if you had a loved one with heart disease or cancer, how would you go about being by their side and helping them walk that journey is basically what the memory care clinic does, correct?
And that's just it. Everybody's journey is unique, Barb, because different dementias present different ways. And they also, it depends on the length of time behind it. And so some of them can strike people in their younger ages, for example, like frontal temporal dementia. And then that is not as long of a diagnosis, such as someone that has more of like a vascular dementia or an Alzheimer's type dementia. And when I talk about that, I think that's a common misconception, that people really think Alzheimer's is dementia and that's it. But Alzheimer's is one type of dementia. It's the most common type of dementia, but that doesn't mean everybody has that when they have memory loss. And so it's based on, the diagnosis is really based on the characteristics and how people are presenting, and then when they also are presenting, because that's a little different depending on your age too.
And I find that interesting, naming off some of the different types of dementias or the different categories within dementia, because I imagine that there's many other dementias kind of placed within there. Just sharing how they present, so it may not always be necessarily, oh, they're forgetting something, but maybe it's just their personality is changing, correct?
Well, it can be some of that. Think about the depression and anxiety piece. So what happens as we get older? How many changes do we encounter in life? Number one, sometimes it's a move from a place that you can't be at safely anymore or can't manage and keep up. We have a lot of farm folks around here. It's a farming community. So if we can't stay on the farm because we can't blow snow, we can't shovel, can't get down to get the mail, can't do the livestock, can't feed the cats and dogs and need more help, you got to maybe come off the farm. That's a very big change. And think about how that would feel when you were younger, if you've ever moved, but now take a whole lifetime of memories and everything else that's going on, but recognizing that you need more help or something smaller that's manageable. So that's a big change. Number one, think about the loss of loved ones that are around you, a spouse, friends, family. I mean, that's a lot for somebody to, you know, have to encounter over and over again. You think about independence. So how many people that get older can maybe have changes in their vision, such as macular or glaucoma, and they can't drive anymore and be as independent. So there's all those things that factor in, and then we wonder why maybe there's depression and anxiety that might cloud memory. So it's looking at those pieces, but then if we're also able to look at those pieces and get rid of the things that are maybe causing the troubles, maybe we see improvement in memory. And one of the nice things that I think that Memory Clinic incorporates is working alongside therapy services, because there are things that we can do to kind of jog the memory and help it along. There's tricks, and there's things that we can do to kind of make people as successful as they can with that working memory, the pieces that are still functioning well.
Yeah, talk about that. I heard you say at the beginning that you work with the occupational therapist and the speech therapist, and I'm going, with dementia, so how does that piece fit? What's their purpose in this clinic?
So part of what occupational and speech therapy can do is really do some separate screenings to figure out where somebody's memory's at and the strengths and the weaknesses that it has. So on the first evaluation at clinic, we'll do some screenings plus looking at the rest of the medical information, and that's kind of the preliminary. But it's hard for me to base where somebody's at with their memory unless we kind of go through and do some more of those sub-tests, because it really says, you know, the short-term memory is working, the long-term memory is having troubles, the problem solving is part of this, the sequencing is part of this. And so once we know where there's deficits or there's troubles, then it's working on that care plan or that those pieces with patients and families to figure out, okay, if you always have trouble with remembering your schedule, is a daily planner going to do it? How does that look? If there's trouble with medication setups because it's following those sequences of setting up your medicine, can we use, for example, one of the local pharmacies that can bubble pack medications so somebody doesn't have to do that? So there's ways of making life easier in your current surroundings instead of, you know, making that big change. And if somebody doesn't need to move to a different location, maybe it's just tweaking what they have and helping out.
And I think that piece was really huge and critical that Clarissa was sharing, that we don't just think and remember. It's all these ways that we use our brain to think out our next step or our next question or our next word or what we're going to do next. It may be sequencing or you know, all those different things, and figuring out where that little glitch is, like you said, and being able to really truly help them. I think that's just a huge, huge piece. So if someone wants to come to Memory Care Clinic and they want to have that discussion, how do they begin the process?
So there's a couple ways. So the first thing you can do is talk with your primary care provider who can help place a referral. However, if you don't have a local primary care, that doesn't matter. You can call into the Avera clinic and just ask for memory care. And then our care coordinators, I mentioned Amanda and Courtney, actually follow up and they make appointments with patients and families. They send out all the preliminary paperwork. So it's kind of a gathering of information in case we don't have everything that we need. And then you come in and visit with me and have a cup of coffee and we chat kind of like we do right now.
Oh, wow.
So
having a cup of coffee, now that sounds pretty easy to me, right?
Yeah.
We'll just sit down, have a cup of coffee. She'll just ask some really gentle questions. You won't even know what she's asking in a sense, but she'll figure out where the gaps are or how she can help and fill in those gaps so that the journey's easier. Not only for the person with it, but let's talk about the person who is the caregiver or the family that surrounds them. How do they fit into this memory care clinic and the person's life?
So they are kind of the forefront. I mean, these are the folks that are in there helping out with someone that has memory loss. And I think one of the things that we often overlook is, you know, parents are coming in with maybe a loved one or an adult child, and it's, hi, how are you? Oh, your labs are due. Let's renew your medications. We'll see you in a year. Everything's good. Okay, but how about the caregiver that's struggling with depression or feeling overwhelmed or don't know what services are out there in the community that can be helpful, such as home health or adult day services or, you know, Meals on Wheels, you know, some of those different things. And so I think it's very important to bring them in to say, how's it going for you? What can I help out with? What things are working really well? What things are you guys struggling with? And then communicating about that, because if you're starting to see that all of the things that are being done in the home are not meeting all those needs and you're still feeling very overwhelmed, are we doing the right thing by staying at home? And if that's not the right place for mom, dad, or a loved one, then what is? And what does that look like? Because we have lots of levels of different care in Marshall, which is a blessing to have in this community, let me tell you. But it's figuring out, when do we need that next step? And I think one of the other things that's really important that Memory Clinic we do is I like to review with people about their advanced directives and their healthcare choices, because a lot of people that come visit with me have never talked about that before. And it's a very important topic to have discussions on while you still can if you have memory troubles.
I love that you bring up the advanced care directive. I mean, everybody says, I don't want to talk to my kids about my will. I don't want to talk to them about what I want in case I die. It's like, but if you don't, then how are they truly going to know what you want? And if you're out there listening, if you think about it, I mean, I look at my own family with my 3 children. I know every one of them would pick something different for me. Every single one of them. Partly because of the age, the journey we were on when they were being raised up. They're only probably 2 years apart and a year and a half apart, so there wasn't like this huge age spread, but they're all so uniquely different that they would choose a different health option for me, every one of them. But instead, if you have that conversation, it takes pressure off you, and it also takes immense pressure off them when they're in that moment of not wanting to lose a loved one, and you've just said, this is what I want.
Well, and imagine having that moment with all the stress and anxiety and trying to make those decisions. And imagine all three of them coming from that different place in that moment, trying to come together without a yelling match, you know, at bedside of mom or dad, trying to figure it out. And, you know, ultimately, the other question that we have to always keep in mind is, you know, we might have our own opinions, but what would our loved one want? Because they're the ones that have to live with that decision that we're making for them. And so imagine how nice it would be to be able to give that gift to your family of, you know what, if things happen and memory continues on this path, or my cancer continues on this path, or whatever that looks like, this is an okay treatment, this isn't an okay treatment. And we can't plan for every future, or excuse me, every option that might come in the future. But I think it's important to at least start with, you know, I would be okay if I'm in good health that you would try and resuscitate me if my heart stopped and I stopped breathing. If I became very weakened and couldn't eat and drink anymore, I don't want a tube feeding. I don't want artificial nutrition. You know, if it's my time to go, that's okay with me. And I think a common thing that people don't want to talk about is not only that piece, but they don't also understand if we don't talk about it and there's nothing on file, everyone is considered a full code, which means all interventions that we can do medically to keep someone alive, we need to do unless someone speaks up for them if they can't speak for themselves. Which some people may be okay with, but some people may not be. And so how do we honor those wishes and have those conversations as part of that? And so it might be a little scary and it might be kind of hard sometimes, but I think ultimately the conversation happens a lot easier when you're not under stress and trying to make those decisions in a crisis, because that's tough. I always think the crisis mode is the worst mode to have any of those conversations, and I think we tend to see that more often than the reverse. So this would be the biggest gift that anybody can give one another, and it doesn't matter if it's you helping your parents or you doing it yourself, because none of us are guaranteed. I have an advanced directive. It's done.
Yeah, I do too, and I have a will. But it's because when you see those journeys and I walked through a few of them, you know the importance of them. And I've had a conversation with a gentleman in my office, and here's my challenge to you: get it done. Every time he comes in, I said, "Did you have the conversation with your children?" "No. Just a little too tough. I don't want to talk about that." And I said, "But if you don't, how are they going to know?" I mean, really, how are they going to know? And I also think the other part is I mean, that would be something that they can have with their primary, they could come in and visit with you. The advanced care directive is sometimes we just fill them out and don't really realize what we're checking. Like, do you really understand that if you say do not resuscitate, what that means? Or if you want to be resuscitated, what the impacts are to you and your body and what situation you may be in. You know, some of those pieces. So just having that really clear that as you make those decisions, if you aren't sure, we do have resources right here, Marshall, to have that conversation with.
Well, and part of it is some patients and families come in and they've had the same healthcare provider for years and years and years. And so I always tell them, you know, part of it is go through the document, look at it as a family, bring it back in if you're following up with me, or bring it back into your primary care provider and review it. The second piece is if you have a document on file, I like to review it every year with patients and families, because things change. And you might want different things for your healthcare, or your family also might need to be updated on things that are changing. And so the other piece that's really nice as far as that conversation is you give the time that whoever is going to be your voice, you give that conversation time so that they know how to answer for you. And remember, healthcare directives, I get this question a lot, How is that going to work when I can still speak for myself? Healthcare directives only go into play when you can't speak for yourself or you're not of sound mind to be able to make those decisions.
Right.
And so the other thing is I have had patients and families say to me, well, what if I want to change it? Can I, if I do it, I can't ever change it. Well, that's not true. It's only as good as the next version will be, and the next version will take over whatever was in place already, I guess is the way to put it. So it's updated. So you can do that as often as you want, or it can be once and you look at it in 10 years. Hopefully that's not the case. Yearly is a good plan. Or when there's a significant change in your healthcare, that's another good time to take a look at it too.
And I think that's really critical. Like if you have a big change in your healthcare and maybe you're, from information you've gained and knowledge you've gained, you say, okay, at one time I really wanted DNR, but now I don't. You can go in and change that, that advanced directive. But the other key part too is having the ability to change it to what you truly want, and then to share it. Don't just fill it out and tuck it in a drawer and think, oh, they're going to follow it.
Does no good in a drawer.
You know, really sit down and, like Clarissa said, the person you're naming as your I'm going to say power of attorney, but that's not right.
Healthcare agent.
Healthcare agent. That person really needs to have that conversation like this with you. You think it's going to be hard, but just saying that first sentence opens that door, and that conversation will take place very easily. So have that conversation. And if you're not sure, and share it with your healthcare facilities. They need to know too. If you change it and you continue to change it, please share that back with the healthcare facilities and the person that is going to be your voice.
Yes.
I think that's just some really critical pieces. Just on a final quick note, let's go back to memory care. I laugh at the center sometimes because they'll say, oh, I forgot where I put my keys, but I finally found them. I guess I'm losing my mind. And I always respond to them, no, you haven't lost it. You remembered that you lost them, so you're okay. So sometimes I think people get worried that they're having memory loss, and perhaps they're not really having memory loss.
So one of the things that's important is if the short-term memory is really engaged and still working, you can retrace those steps and figure out whatever you're trying to figure out. For example, the keys. You sit down and think, where was I? Oh, last night I went to the pizza ranch, and then when I came home I had to let the dog out, and then I put my purse down and my keys were right next to that in the bowl on the entryway table. Oh, lo and behold, you thought your way back all the way through that process. That's still a working memory that's working. Now, if you get to that point where you can't remember what you did last night and you can't remember where you put your keys despite thinking about it, now that's where we have those issues. And that's some of those subtle changes. Sometimes it's also word choices when you're carrying on a conversation with someone, or maybe it's something that's been familiar for forever and you can't put those pieces back together again, like writing a checkout, or, you know, some things that are those day-to-day things. If it's a constant issue that keeps happening, then why not ask the questions and check on it? Because there are things that we can be doing and be proactive when it comes to memory loss, but you have to take the first step and start talking about it.
Definitely. And I think that's really important. Taking the first step. It'll make the journey easier. It doesn't take away some of the difficulty or the pain in that journey, but if we can make it easier, and I think you touched on it, and we've got just a couple minutes left, that the resources in this community are really astounding for the size of community. We have services on so many different levels here that I don't think people know, and I think it's because people don't want to ask, because they don't want to even mention the word. So you said there's all kinds of levels. How many levels do we have right here in Marshall?
That's a tough question, Barb.
I
know. Well, let's start at home. What kind of things do we have? We have home health services through multiple agencies. Sometimes hospice can be part of this journey, and they can come into people's homes and help support. We have adult day services still in the community. You know, moving up from there, what's next? You think about assisted livings, or even we'll start with apartments with services. So you can have your own place, but you can have as much help as you need to in those facilities. And you know, sometimes meals are part of that. Cooking gets to be hard as you get older, just because of not only physically doing it, but how do you cook for one and not eat the same thing for 4 nights in a row? And so that becomes kind of a problem. You know, and then up from there we have assisted livings, which can be more with staff around the clock being present and there when you need them. We also have memory care units, which are secured units for loved ones that may wander or have increasing needs with regards to their care, or a little bit of both. And then we also have skilled nursing facilities or long-term care facilities. So we have a lot of different levels of different care, just depending on what people need and where they're at in that journey. So,
yeah. And I think that's just amazing in the Marshall community. So many people don't realize that. And then the other thing I would say, and this will be my last question, is that everybody's journey is different. So what may be working for your friend or your cousin may not be the right solution for you in your journey. So don't just automatically assume that, okay, if I have a memory loss, I'm going to go do this, this, and this because that's what my cousin did, or that's what my mom did, or that's what my friend did.
And I think that's good to take that advice, but that also starts the conversation, Barb. So if that's what it's going to take to get someone to start talking, then maybe we talk about why that would or wouldn't be the right choice for you, and then we make that decision together. So part of my job is to help people understand where they're at with their memory loss, and then guide them from there and say, look, here's our options. You know, we could start a medication that may help keep that memory stable as possible for as long as possible. But if you get an upset stomach and you can't take the medication and it's making you sick every day, then it's probably not worth it. So we have to look at something different. So everybody's plan needs to be tweaked and altered depending on where they're at and what they're comfortable with, because what someone may be comfortable with, mom, friend, whoever that may be, might not be what you want. So it's kind of that individualized care.
It may be very similar, or it may be very different. Just depends upon what's working for you.
You got it.
Yeah, so really take some time out there in the Marshall community. If you have any questions, give Clarissa a call. I mean, you can see how easy the conversation is. It's not scary at all.
Cup of coffee. That's all you
cup
need.
of coffee. We'll sit down. If you don't like coffee, I'm sure we can find a glass of water or a cup of tea. And we'll just have the conversation, because it'll make the journey easier. And I think when you make the journey easier, you're able to capture more memories, and that's what you want to do in life's journey. You want to capture those memories.
Quality
of life. You don't want to lose those memories, that quality of life, just by struggling with what to do next. So make the call. Clarissa, how can they reach you?
Yes, so if you call into the Avera clinic, it's 537-9007, option 4. And if you ask about memory care services, they will get you to the right place. And you might even find me on the phone. So if no one else, answers the phone right away, they will find me next.
Yeah, there we go. So you might even get directly to Clarissa.
Yeah, there you go.
So Clarissa, it's been wonderful talking about this topic. Out there in the community, take the step. It'll be well worth your time. Thank you.